we will be talking about the chemical methods of control. Quite often, chemical agents are very widely used for microbial control. This is because their use is convenient as well as practical. For example, wiping the tabletop with a disinfectant before a microbiology experiment or wiping the skin with an antiseptic before an injection. A careful selection of the chemical agent depends upon a number of factors. The first is the type of the material to be treated. It is always better to have a complete knowledge of what is to be sterilized. One cannot use an antiseptic for sterilizing a tabletop or a disinfectant for sterilizing skin. This is because the disinfectant, being stronger, can cause harm to the tissues of the skin, and the mild antiseptic, though suitable for the delicate tissues of the skin, might be completely useless on an inanimate surface. The second factor is the type of the microbes to be removed. It is again better to have some idea about the type of the microorganisms which might be predominant on the material to be sterilized. This is because not all chemical agents are equally effective against bacteria, viruses, fungi, and other microorganisms. Among the bacteria, a particular chemical agent might be more effective against gram-positive bacteria than gram-negative. Hence, a careful selection of the chemical agent is a must for effective disinfection. The third factor is the influence of environmental conditions. We know that environmental parameters do have an effect on the growth of microbes and hence would also play an important role in controlling the growth of the microbes. While selecting a chemical agent, one should keep in mind the effect of these parameters on the agent so that it can be used under the most favorable conditions. An ideal chemical agent should have some of the characteristics stated below to be an effective and safe chemical agent. The first is antimicrobial activity. Ideally, a chemical should be effective against a wide variety of microbes and that too at a very low concentration. Toxicity to humans. At the same time, it should be totally harmless and non-injurious to the humans and other living things. In practice, though it is very hard to achieve a balance between low toxicity and effectiveness. The third factor is solubility. The chemical agent should be readily soluble in water and other solvents so that it is easily applicable. The next factor is stability. The chemical agent should be stable upon storage and should show no decrease in its activity upon standing. The next factor is the ability to penetrate. The chemical agent should have an ability to penetrate through the surface so that it has a deep reaching action, or else its action would only be at the surface level. The next factor is odor. It should be either odorless or it should have a pleasant odor. The next factor is non-corroding. The chemical agent should not have any corrosive effect on the metals, nor should it have any harmful effect on the fabrics, etc. The last factor is reaction with organic matter. If there is considerable amount of organic matter along with microbes, some chemical agents have a tendency to react with the organic matter, and in such cases there will be very little of it left to react with microbes. Hence, an agent which does not react or reacts less with organic matter is preferred. The important chemical antimicrobial agents used as disinfectants or antiseptics are phenols, alcohols, halogens, surfactants, heavy metals, and gaseous agents. Let us first talk about phenols and phenolic agents. Phenol has a history of being used by Sir Joseph Lister way back in 1867 to reduce the risk of surgical infections. Phenol also has the credit of being used as a standard against which the antimicrobial activity of other disinfectants is compared by using a technique called phenol coefficient technique. Phenol refers to the class of aromatic compounds having a hydroxyl group as well as other substituent groups on a 6-carbon benzene ring, as can be seen on your screen. Phenol is bacteriostatic at concentrations of 0.1 to 1% and is bactericidal or fungicidal at 1 to 2%. A 5% solution of phenol kills anthrax spores in 48 hours. The bactericidal activity is enhanced by EDTA and warm temperatures and decreased by alkaline medium, lipids, soaps and cold temperatures. Concentrations greater than 0.5% exert a local anesthetic effect, whereas a 5% solution is strongly irritating and corrosive to tissues. Oral ingestion or extensive application to skin can cause systemic toxicity manifested primarily by the central nervous system and cardiovascular effects, which may lead to death. Phenolics are the phenol derivatives which have been chemically modified by the addition of some organic functional groups. Phenols and phenolic agents like cryzols, xylenols, orthophenylphenols are very effective disinfectants. A 5% to 6% aqueous solution of phenol is effective in killing vegetative cells but not spores. The commercially available Lysol is a mixture of phenolics. Bisphenols, a combination of two phenol or phenolic molecules, are widely used in modern disinfection and antisepsis. For example, orthophenylphenol is used in Lysol, hexylresorcinol is used in mouthwash and throat lozenges. Triclosan used in a number of consumer products. Hexachlorophene has a strong bacteriostatic action against many gram-positive organisms and was used as a popular household bisphenol, but it was found to cause brain damage in infants and now it is used only in response to severe staphylococcal infections. The mode of action of phenols and phenolics mainly kill the microbes by denaturing the proteins, inactivating enzymes and disrupting the cell membrane. They are advantageous because they remain active on the surface long after application as compared to volatile halogens or alcohols. Their drawback is that they have a very disagreeable odor and also cause skin irritation. Let us move on to what is called as the phenol coefficient determination. This technique is used to determine the effectiveness of the test disinfectant as compared to that of the phenol under similar conditions. The procedure for this includes that a series of dilution of phenol and the experimental disinfectant are prepared in sterile tubes. The test organism, which may be E. coli or S. aureus, is inoculated in each of the dilution tubes and then they are incubated for 5, 10 and 15 minutes. 100 microliter is then transferred from each tube to a fresh sterile broth tube, and then it is incubated at 37 degrees for 48 hours. The highest dilution of the test antimicrobial agent and phenol that effectively kills the test organism within 10 minutes but not within 5 minutes exposure are used to compare the phenol coefficient. The turbidity indicates growth and is labeled as positive, and no turbidity indicates that there is no growth and it is labeled as negative. In the table, you can see the values for both the disinfectant as well as phenol. Here, the phenol dilution of 1:70 failed to kill the test organism in 5 minutes but killed it in 10 minutes. The test infectant gave the same results at the dilution 1:200. Therefore, the phenol coefficient is calculated as the highest dilution of the test infectant upon the highest dilution of phenol. This gives us the result as 200 upon 70, which equals to 2.8571. Thus, the disinfectant is more effective than phenol. Agents with a phenol coefficient greater than 1 are more effective than phenol. The next chemical agent that we are going to talk about is alcohol. Alcohols are quite effective against bacteria, fungi, and some viruses, but not against spores. Their potency increases, but water solubility decreases with the chain lengths. Ethyl alcohol is the most commonly used alcohol. Methyl alcohol is less effective as compared to that of ethanol. Furthermore, it is poisonous and hence not used as a disinfectant. The higher alcohols like propyl, butyl and amyl are also germicidal than ethyl alcohol. Alcohol is routinely used to disinfect the skin before injections or drawing blood. It is also used to disinfect thermometers and small instruments like forceps, scalpels, etc. by immersing them in alcohol for 10 to 15 minutes. Surprisingly, 70% ethanol is more effective than absolute alcohol. This is because absolute alcohol has a strong dehydrating agent effect which causes the pores of the cell to close and prevents the entry of the alcohol inside the cell. This causes only the surface proteins to get coagulated, which is just bacteriostatic. When the conditions for the cell become normal, the cell will start growing again. On the other hand, 70% alcohol allows the alcohol molecules to penetrate inside the cell and cause complete coagulation of proteins inside the cell, which ensures cell death. The mode of action of the alcohols is that alcohols act as an antimicrobial agent by denaturing the proteins. They are solvents for lipids and hence also dissolve the membrane lipids and cause damage to the cell membrane. Alcohols are dehydrating agents and can bring about dehydration of the cells. The use of alcohol as a surface disinfectant is probably more due to the mechanical removal of microbes than the chemical action on them. The next chemical agent is halogens. A halogen is any of the 5 elements chlorine, fluorine, bromine, iodine and astatine belonging to the group 7A of the periodic table. The halogens, iodine and chlorine are important antimicrobial agents. They can be used alone or combined with some other elements. Let us first talk about iodine. Iodine is one of the oldest antimicrobial agent and has been used for more than a century now. It is used as a skin antiseptic and is effective against bacteria, fungi, and some viruses. Iodine is not very soluble in water but is soluble in alcohol and aqueous solutions of sodium or potassium iodide. It finds its use as tincture of iodine, which is 2% or more iodine in water ethanol solution of sodium or potassium iodide. Although it is an effective antiseptic, it has its drawbacks of causing damage to skin, leaving stains on the skin, and causing skin allergies. More recently, iodine is used as an iodophore in which it is complexed with an organic compound. It releases iodine slowly and has the advantage of being long-lasting, non-irritating, and non-staining. Betadine is a well-known example of an iodophore which is applied to wounds. It can destroy bacteria, fungi, and some protozoa, but not endospores. Iodophore solutions retain good antimicrobial activity at pH less than 4 even in the presence of organic matter. The mode of action is that it acts as an oxidizing agent and it might oxidize important protein and enzymes and account for cell damage. It is also suggested that it may act by halogenating tyrosine residues of the enzymes requiring tyrosine for their activity. The next halogen is chlorine. Chlorine is one of the most widely used disinfectants. It is used both in its gaseous form and also in its combined form. Chlorine gas has been used since ages for purification of water supplies. Chlorine gas is difficult to handle, hence its usefulness is limited. A number of chlorine compounds are available and they are easier to handle than free chlorine. These compounds are sodium and calcium hypochlorites. These compounds are used in dairy industry and restaurants to disinfect utensils. Hypochlorite has a history of being used by Sir Ignaz Semmelweis in 1846 to reduce the incidence of childbed fever. The practice was to wash hands and soak them in hypochlorite solution before examining patients. This practice had reduced the infections to 1/3. Another important group of chlorine compounds are the chloramines, which are chemical compounds of chlorine and ammonia. Examples are monochloramine, chloramine T, azochloramide, etc. They are used in wound dressings as skin antiseptics and also for treating water. They are less effective than hypochlorites, but they are more stable, release chlorine slowly, and are long-lasting and hence more preferred. Chlorine dioxide is a gas that can be used to disinfect large spaces. For example, it was used to treat the office buildings contaminated with anthrax spores after the bioterrorism attack of 2001 in US. The mode of action. The action of chlorine and chlorine compounds is mainly due to the formation of hypochlorous acid, as can be seen in this equation. The hypochlorous acid formed is further decomposed to form nascent oxygen. The nascent oxygen is a strong oxidizing agent and acts on cellular components to bring about the destruction of microbes. Organic matter interferes with chlorine action by reacting with chlorine. Hence, excess of chlorine is added to ensure complete microbial destruction. The next halogen is bromine. Bromine is yet another halogen which is used for chemical control, but its use is particularly restricted to recreational and industrial water disinfection, including swimming pools, chlorine towers, etc. 2 to 4 mg per liter is enough over a wide temperature of 5 to 45 degrees and a pH of 6 to 9 range. The compounds of bromine are well-established broad-spectrum antimicrobials. In comparison to chlorine, bromine is considered less volatile and less toxic to aquatic life, but it is very irritating. They are also less corrosive, have a lower toxicity profile, relatively safe to use, and easy to handle. The formation of bromate and haloacetic acids as byproducts of water disinfection are of concern because these compounds are known to be carcinogenic to humans. The presence of UV light and reducing agents can degrade bromine and decrease its overall efficacy. The use of methyl bromide is banned in many countries because it is a neurotoxin and it is also able to damage the ozone layer. The mode of action: when bromine is dissolved in water, hypobromous acid and hypobromite ion are formed, which are responsible for the antimicrobial activity. Bromine also reacts with ammonia or nitrogen compounds and produces bromamines, which too have an antimicrobial activity. Similar to other halogens, bromine oxidizes organic molecules like proteins, nucleic acids, and lipids, which results in cell death. Also, methyl bromide reacts with sulfhydryl groups of protein and enzymes, which leads to inhibition of cellular biochemical processes. The next halogen is fluorine. Fluorine too is a halogen and is one of the most reactive chemicals. Fluoride is claimed to reduce the incidence of dental cavities by reaction with tooth enamel. A number of different fluoride compounds like silicofluorides, stannous fluoride, and amine fluorides are used for water treatment, toothpastes, mouthwashes, etc. Sodium and potassium fluorides have been used as preservatives, but they are of limited use now due to their toxic effects. Let us now talk about heavy metals as antimicrobial agents. Many salts of heavy metals like silver, mercury, and copper are used as antimicrobial agents. The action of heavy metals on microorganisms is termed as the oligodynamic action. These metals are at very low concentrations exhibit antimicrobial activity. A small piece of heavy metal is placed in the center of the sterile nutrient agar plate, seeded with a test organism like Asorius, and the plate is incubated. Small quantities of metal diffuses into the agar and inhibits the growth of the test organism, as can be seen on your screen. The inhibition of the growth of the organism is seen as a zone of inhibition. Let us talk about these heavy metals in slight detail. Silver. In the olden days, a few drops of 1% silver nitrate solution was placed in the eyes of the newborn babies to protect from infection by Neisseria gonorrhoeae. A 0.5% solution is sometimes applied as a dressing on burns to reduce infection. Colloidal silver compounds which release silver ions slowly are bacteriostatic and have a more sustained effect. Today, silver nitrate has been replaced by antibiotic ointments which are less irritating and effective against pathogens also. Copper. Copper is not only bactericidal at low concentrations but it also has an algicide and it is also an algicide and fungicide. It is used as copper sulfate in swimming pools and water supplies. Copper compounds are also used as preservatives in paints, cement, fabric, etc. to provide an antimicrobial barrier to surfaces where they are applied. Mercury is used as an antimicrobial agent since many years. It is used as mercury chloride in products like mercurochrome, merthiolate and metafe. Mercury is combined with organic carrier compounds that reduce its toxicity. The mode of action. The antimicrobial action of heavy metals is due to their ability to react with the sulfhydryl groups of cysteine residues in the cellular enzymes. Further reactions can also lead to formation of hydroxyl radicals. This changes the configuration of the enzyme proteins, which in turn lose their biological activity. At high concentrations, they may also precipitate cell proteins, resulting in cell death. Positively charged ions have an affinity for negatively charged bacterial cell surfaces. Cell surface attack can lead to altered permeability and disruption of cell wall and membrane functions. Copper and silver ions also bind to phosphate backbone of DNA, leading to damage. Let us now talk about the gaseous agents as antimicrobial agents. There are many equipments and apparatus like plastic syringes, rubber gloves, plastic pipettes, plastic petri plates which cannot be sterilized either by dry heat or moist heat because they are damaged by it. These are sterilized by gaseous agents. Large spaces like laboratories, operation theatres and storage rooms are also sterilized using gases. When gaseous agents are used for sterilization, it is called fumigation. Chlorine and sulfur dioxide were used for fumigation earlier, but they are too poisonous for general purpose and hence they are no longer used. Presently, formaldehyde, ethylene oxide and beta-propyolactone are among commonly used gaseous agents. Let us first talk about formaldehyde. This is a very irritating gas but can be generated by heating concentrated solutions of formaldehyde. Unless used at raised temperatures, it has a tendency to polymerize to form thin films of paraformaldehyde and hence its use is limited. But its killing effect, it's a irritating gas that can be generated by heating concentrated solutions of formaldehyde. Formaldehyde has a microbicidal effect, killing both the vegetative cells and spores. But its killing effect is greatly influenced by factors like humidity and temperatures. For best results, the temperature should be around 22 degrees and humidity at 70%. However, there are some disadvantages associated with the use of formaldehyde as a fumigant. These are: it has a low penetrating power and hence acts only at the surface. Secondly, it is very irritating to tissues and eyes. Thirdly, it is not very stable. And finally, the residual gas remains for a long time even after the aeration. The mode of action: it is a strong reducing agent. It combines with nitrogen containing macromolecules like proteins and nucleic acids and denatures them. The next gaseous agent is ethylene oxide. The compound ethylene oxide is a gas at room temperature. Its boiling point is 10.8 degrees Celsius, below which it is a liquid. In its pure form, it is very toxic when inhaled, irritating to the skin and eyes and highly inflammable. Hence, for commercial use, it is mixed with carbon dioxide or freon. For example, 10% ethylene oxide and 90% carbon dioxide is commercially available as carboxyl, or 20% ethylene oxide and 80% carbon dioxide is available commercially as oxyfumes. These preparations are not inflammable and the microbicidal activity is also not compromised. The use of ethylene oxide as a sterilizing agent is widespread because not only is it microbicidal but also sporicidal. It is routinely used for sterilizing heat and moisture sensitive materials in hospitals and laboratories. It is a better sterilant than formaldehyde because it is inexpensive and readily available. It has a deeper penetration power and it is quickly removed by airing, and hence the residual gas does not remain for long. Commercially available apparatus for application of ethylene oxide is an autoclave which allows the chamber to be filled with the gas and which has controls for temperature and humidity. For practical purposes, 500 mg of gas per liter is used at about 58 degrees and a relative humidity of 40% for approximately 4 hours. Ethylene oxide chambers are called gas autoclaves, and they have become the chemical counterparts of heat and pressure based autoclaves for sterilization purposes. The mode of action: ethylene oxide acts by alkylation and introduction of an organic group in place of a hydrogen atom in various molecules like enzymes and proteins. For example, the hydrogen atom in a free carboxyl amino or sulfhydryl group is replaced by an alkyl group. Beta-propyolactone. At room temperature, it is a colorless liquid which has a sweet but irritating odor. Its formula can be seen on your screen. It has a boiling point of 155 to 160 degrees. It is not inflammable like ethylene oxide, but at the same time, it causes irritation to eyes. It kills both the vegetative cells as well as spores, and hence it is a good sterilizing agent. A relative humidity of 70 to 80% and temperature of 25 degrees is required for maximum activity. It is more active than formaldehyde and ethylene oxide, but at the same time it has less penetration power. In aqueous solutions, it undergoes hydrolysis to form inactive beta-hydroxypropionic acid. Also, its prolonged use is said to be having carcinogenic effects, and all this has limited its use for practical purposes. The mode of action: its mode of action is similar to that of ethylene oxide. It also acts by alkylation action on enzymes and proteins. With this, we come to an end of our discussion on chemical agents which are used as antimicrobial agents. Hope you liked the content of this video lecture. Thank you.